Good morning, everyone, and welcome to the inaugural Recovery Trial face-to-face meeting. It's great to see you all, and thank you very much, everyone, for making the time to travel down here.
I've done this trial. I've been part of this for 2 years, and this is the first time we're having like a physical meeting, and it's very important outside understanding what happens in my immediate environment, hearing from others' perspective and how far we've gone. It creates a bigger awareness outside what happens in my immediate environment. So I came around today to hear from others, see their best practices and how we can implement this.
I don't think you have a choice. I think when every ward has got a COVID patient on it, every ward is full of COVID patients, including recovery and theatres, you have to all collaborate. You don't get a choice in it. And nobody knew how to treat it. So from the very first patient of recovery to the very last patient on the COVID, they had to know who I was. They had to know why I was there. They had to know what medications we could offer, even though they didn't know if any of them could work. And we just had to get on with it. And luckily, that kind of collaboration, the fact that I was a consistent member of the team all the way through to the pneumonias, enabled me to carry on with that throughout that all.
I came to this event, just to hear what other sites are doing and just see what other people's experience of sort of the recovery trial has been, and just see what other sort of strategies are going to be implemented going forward with treatment, and maybe see what some of the preliminary results are.
It's a great trial to be involved in for several reasons. The main reasons I'd say is it's one of the simplest trials I've ever been involved in terms of what it actually takes to get someone into the trial. There's a very simplified randomization process. Compared to a lot of commercial studies, it's so much simpler to do. It also is relatively easy in terms of getting junior doctors and other health professionals trained to take part in the trial, given the minimal training processes compared to other trials.
It's probably the easiest study I've ever worked on in terms of delivering. It's very effective. I don't know if it's because I did it for 5 years, but it's a good study to be able to sort out. And also you see the help it actually makes people. It's found to have proved things and help with treatments.
Today there has been conversations about how quick things have turned around from trials to improvements in practices, and that's the importance of research, being able to do this trial, get the results and improve patients' care and practices. Very phenomenal, and recovery has tried to do this in a way that I don't think has ever been done before in this large scale, so it's very important.
When you've got these larger multi-center studies, it's good to get to know other people that you are working with on the same trial, just to see if you can learn from each other, to see if shared experiences can help solve some of the problems that you have. So say if you have a particular problem with recruiting patients, or if you want to sort of improve some of your own workflows, then you can see what other sites are doing and share those experiences. It's always helpful.
If you want a metric of success, 1 million lives saved, there are roughly 10,000 names on that list of collaborators investigated in the back of all the papers. Divide one by the other, and on average, each person who's listed at the back of that protocol saved 100 lives by their contribution into the study.
I think the key takeaways for me would be, first, some of the really interesting statistics around how many lives have been saved, how important the trial was, but also some of the interesting new results from the extended studies, the long-term studies, looking particularly at things like non-COVID related infections and risk of complications in people who are severely immunocompromised.
Research is not about what's working, it's also about knowing what's not working, so we stop using them. And so far, getting to know about the results from the different arms of the study means we understand what's working, what's not working, and dropping off things that are not working so that care is streamlined for the patients that we care for. So that's the biggest takeaway today so far.